Hey guys, today I'm here to talk about the intervertebral disc, okay, and that's the cushion that goes between your spinal bones or your vertebra, okay. It's made of cartilage, okay, and when our spine is not in our normal healthy position or it's not moving correctly, those discs will wear out, and that can happen through injury, all kinds of things, okay. Poor posture, repetitive stress, all kinds of things can cause the spine to become subluxated and to be out of alignment and to wear unevenly, okay? And so what happens? Why is the disc so important? Well, the disc now looks like this, okay? So in the middle we have a nucleus, and that is a gel-like substance, okay? And around it is a tough, what we call annular fibers, okay? And they are very, very tough, but they're pliable, okay? So they cause movement. And what happens when we get injured is the body wants to splint. It wants to immobilize that segment so it can heal, right? And that's okay. But what happens is it heals with scar tissue, and over time it doesn't regain all that proper motion, okay? The problem with not having motion in a disc is this. Our discs do not get any blood supply. They're what we call avascular. There's no vascularity going into the disc. And so every other cell in our body is actually getting nutrients and transporting the waste out of the cells through our blood supply, except for the disc. It relies on a process we call imbibition. It's like a sponge-like effect. When it moves, it spits the waste products out, sucks new nutrients in. The other thing it does is it hydrates that way. When the disc is not being, and then that joint is not moving correctly, we're not getting that process happening, and it starts to thin the disc and it starts to degenerate, okay? And the disc gets thinner, and we have less space in between the bones for the nerves to escape, okay? And also, these discs will start to mushroom out, okay, and will start to encroach on that space as well. And sometimes you can actually have an injury that will cause this gel to push out or to squeeze outside of this annular fiber, and that's what we call a herniation. We call it a disc bulge first, a herniation, and that causes a real problem on the nerve. Oops. This is what that looks like, okay? And you can see as we degenerate, we start to get bone spurs or osteophytes caused on the bones. And once you get to this point, it's a real tough problem, because there's not a lot in there to regenerate or to keep healthy anymore, and our nerve is pretty much being insulted, okay? And that's where you have to take some drastic measures. Personally, I'm going through that right now, all right? And if you're watching this on my blog, you'll understand that, okay? Time to go in and have some drastic measures on that disc. The idea, though, is that we want to make sure we keep the disc healthy, and if we have an injury, even if it's a chronic poor posture thing, we're all sitting at desks all the time, it's not what we're made to do, okay? We're made to move, we're made to go through ranges of motion, and our body is made to move. All of those 24 vertebrae of our spine have joints in between them, and they're supposed to go through the regular ranges of motion regularly, okay? And if they're not, they're going to start to degenerate. So that is why proactive chiropractic care is so important. Many times we don't feel these things happening in our body until they're well under their way, okay? And then all of a sudden we get into a level of degeneration, and we get nerve pressure, and all of a sudden we have a problem. And then we're like reacting, okay? And we're in a crisis situation. So proactive care, maintenance on your spine, makes it go a lot longer. All right? Signing off for today. We'll catch up next time. Cheers.